morning, everyone. I'm Dr. Kanika from Center for Sight Eye Hospital, and today we will be talking about specialty contact lenses. Now, as the name suggests, these are not the conventional contact lenses because they are mainly suitable for people who have corneal conditions or eye diseases which bar them from wearing the conventional ones. So coming to our topic, what are my options? Protection, comfort, and clarity. Let's get into the details. So specialty contact lenses are not just for special eyes. We can use them for various indications, starting with any ocular surface disease, such as keratitis, dystrophies, ulcers, keratoconus, keratoglobus, even lag of thalamus, or even post-trauma, such as those people who have had corneal laceration and have now corneal scars, or even iris colobomas. People who are into sport activities who cannot wear the conventional ones, like those in field and track or water sports. Even those who are post-surgery, like after C3R or post-penetrating keratoplasty. There are others like those after refractive surgery, post-LASIK, and even post-LASIK ectasia. People who have very high astigmatism, and even those who are RGP failures. So there is a different terminology for different type of lenses. We will be focusing on the rigid corneal lenses of various diameters, starting from the rigid gas permeable lens that has been in practice from past many years. But what we are going to focus today is on the corneoscleral or the mini scleral lenses, which have a diameter of about 14.5 millimeter. Now what's special about these lenses? They do not rest on the cornea, and hence they rest on the white part of the sclera, therefore causing minimum irritation to the surface. This is how a scleral contact lens looks. On the left side, we can see an image, a fluorescein-filled reservoir that shows the extent of the scleral contact lens. We can see it is completely covering the cornea and it is resting on the sclera. On the right-hand side image, we can see how the scleral contact lens covers the corneal irregularity and how there is a fluorescein-filled reservoir in between. Now, coming to our topic, how does it afford protection? We know there are diseases, various ones at that, which affect the cornea, leading to unnatural shape of the cornea, or causing a lot of discomfort and dry eye, or even causing the cornea prone to trauma. So in such situations, these lenses provide protection. Because these lenses do not rest directly on the cornea, they do not irritate the surface, they are not uncomfortable, and they also not damage the ocular surface. As I mentioned before, the reservoir, it not just acts as a fluid in between, it improves the clarity, also provides hydration. So this is an example of a 7-year-old child with Stevens-Johnson syndrome. The child, we can see in the left side images, is not even able to open the eyes, and his vision unaided was 360 in both the eyes. Whereas after scleral contact lens application, the child is opening the eyes, and also his vision is improving to 618 and 612. So here it provides protection to the ocular surface. Age is no bar to these lenses. This is another example of a 65-year-old female with Stevens-Johnson. Both the 7-year-old child and 65-year-old female have benefited with scleral contact lenses, which is very evident from the clinical pictures. Now, how do these lenses provide comfort? We know in today's lifestyle, everybody is prone to using screen devices and they have symptoms of dry eyes. So it also provides comfort because they have a reservoir which is about 250 microns to 700 microns thick, and this reservoir keeps the cornea hydrated. Also, it avoids dry eye symptoms. The fluid that is filled inside is a preservative-free saline, which is suitable for people with Sjogren's or Stevens-Johnson's or other ocular surface dry eye diseases. So it fits even most difficult to fit corneas, and it doesn't irritate the cornea. On the right side, there's the video. So this guy had Bell's palsy and exposure keratopathy because of that, because his lid was not covering the cornea. So this guy not only got improved vision with the scleral lenses, his vision improved to 6.6, but also it protected him and provided him comfort from the exposure keratopathy. There's another example. This was a 27-year-old male with keratoconus in his right eye. The patient was using soft contact lenses from before, 2 years prior to consulting us. The patient had started developing severe discomfort, gritty sensation, and dry eye. He came to us to ask for a solution. We shifted the patient to scleral contact lens, and his BCVA improved from 6-9 parts with the conventional lenses to 6-6 with scleral contact lenses. Also, he had improved comfort because his dry eye symptoms were relieved. So we can also give these lenses not just for the corneal irregularities, but to give comfort to the patient. Now, how do they improve clarity? This is evident from my previous slides already that the vision improves. Let us see another case. This is a 30-year-old female, known case of advanced keratoconus. She even had Vogt stria. Her pentacam showed keratoconus grade 4. Her keratometry readings were in the range of 53 and 55 in the right eye, whereas 57 and 60 in the left eye. Patient with spectacles was only reading up to 624 parts in right eye and 624 parts in left eye. The patient, when given scleral contact lenses, improved to 6.9 in the right eye and 6.12 in the left eye. So as is evident from the patient, she was very happy because her vision clarity improved drastically. We can see on the left side how thin the cone was and how the reservoir protects the cone. Also, the lens provides clarity. So to conclude, I would like to say that always do not open new doors. We have to be in touch with the newer technology that is available and to be able to help our patients coming to our clinic apart just from visual rehabilitation. If we never try, we never will know. I would like to extend a special thanks to Mr. Gagan Sahani for all his effort and providing us with the lenses that we use in our clinic. And Mr. Dilip Singh Sidhosnia, who's our senior optometrist and contact lens expert at Center for Sight. We don't have any financial